Horizon TV, the beacon for the nation. This program is suitable for general viewing.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. A healthy nation is definitely a successful nation. In exactly 19 minutes past 8 o'clock, my name is Faisal Kassim and welcome to Live Real Talk. And tonight we'll be talking about matters health. As I said in the beginning, that a healthy nation is definitely going to be a successful nation. That is why even in our religion, the Prophet ﷺ used to ask us, or rather taught us, to be making dua every morning and evening in Adhkarul Masa and Adhkarul Sabah to ask Allah subhanahu wa ta'ala for better health. And tonight we'll be talking about the universal health care for the Muslims community. Of course, there is a program under the current administration, even in the previous administration, about the UHC, Universal Health Coverage. And there's actually a whole strategic plan about the universal health coverage under this government, a vision plan from 2020 to 2030. And tonight I'm joined by Dr. Salim Ali Hussein, who is the Deputy Director Medical Services and Head of Primary Health Care at the Ministry of Health. Dr. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
All the way from Naivasha, thank you so much for joining us this evening, Dr.
Thank you for inviting me.
Naam, Jazakallah khair. Maybe Doc, can just start by, last night you gave a very resounding lecture at the Park Road Masjid about the universal health coverage and how Muslims can benefit from it. What necessitated, maybe just to kickstart this whole conversation, what necessitated or prompted the whole conversation that you started last night at the Park Road Masjid?
Yeah, I think ideally what initiated that talk, the management of Masjid, the Park Road Masjid, they requested me to give this talk because they have seen and have a lot of requests from their Ummah to be supported on health, especially medical bills.
Naam, Doc, Jazakallah khair, thanks, of which that is extremely true. But again, so what's the angle? Because health is one of the pertinent issues, particularly lifestyle diseases in the Muslim community. Talk of hypertension, talk of diabetes, talk of pressure, and so on and so forth. These are lifestyle diseases that are very prominent in our Muslim community, and thus many medical appeals. Every now and then we wake up to medical appeals. And then if you juxtapose it against the whole insurance aspect in Islam, when people are talking about the NHIF, the National Hospital Insurance Fund, or the UHC, it falls under the insurance aspect, and some Muslims are skeptical to even take that path, not unless it's extremely necessary. For example, for those who are employed and money has to be deducted from their salary to pay for NHIF. Otherwise, very few Muslims would be willingly go out and to take the NHIF cover. So how then do we assist the Ummah? How then do we come in and assist the Ummah? One, to change the narrative about the whole insurance aspect, and two, help the Ummah in terms of getting better and being healthy. Dr.
In fact, the uptake of national health insurance is poor generally in the country. Actually, it is about 22% of the population that has taken that insurance. So that links quite well with our Ummah. Maybe it could be a degree higher. But it is important to just put across that it is to have an insurance to cover you, especially when you are sick and you don't know when this can happen. It is important, especially when the charges are very few or are very low, and in terms of when you need it, the coverage could be very high. And this is what, as Ali had alluded to, necessitate most of our ummah maybe to go to several masjid or to relatives to go for support. They have a hospital bill.
Sheikh, maybe just to ask, what measures maybe has the government taken to ensure that the universal health cover program is culturally sensitive and respectful to the Islamic values and practices?
Yeah, when you look at the definition itself of what universal health coverage is, you look at it has principles that actually take care of the custom, the cultural tradition of the people, because it means that you are trying to give health access to a person when he needs it or she needs it, at a time she needs it, putting into consideration those customs, tradition, religion of that person, but more importantly, also trying that that person get those services without suffering economical hardship.
But it's the aspect of extortion that a lot of conventional insurance are actually so good at for as far as the whole insurance scheme is concerned. So in this particular aspect, and you know what Islam says about insurance and extortion, and thus why a number of Muslims, of course it's something debatable among scholars, but again a number of Muslims are skeptical about taking it because it's a jurisprudential issue amongst jurists and scholars in this country. So what has the government done particularly for this? Just to bring in an example, or rather to show how basically previous or other practices have been done, there were initiatives to see, for example, the Higher Education Loans Board to have a Sharia component whereby Muslims would take up the loans and they would pay back without interest attached. Two, in the financial industry, for a very long time, the banking sector has had conventional banking until early 2000s, where a group of people went to South Africa and did a number of research and came back and established the Islamic banking system. So basically, these are systems that at least were sensitive to the cultural and practices of the Muslim community, and of course, they were adhering to the Islamic principles and practices. So in this particular one, I mean, from our understanding, it's coming, or it's appearing to be like an insurance fund. So in that regard then, what has the government done to make it at least Muslim friendly, that is sensitive to the Muslim cultures, practices and values?
I want to look at it different from the issues like loans and the other insurance that are there, because those are very specific, individualistics. They are meant to support you or upgrade what you need to do, especially like, for example, you've given the help loan. It's very specific that it is you who will benefit, it is you who will get the benefit. When we're looking at most of the health insurances, is like a collective responsibility, in that you'll be paying little. One, yes, might be sick, the other might not be sick, but the one who is sick, like now we have agreed collectively, we need to support each other. And with this little that we have, we can actually benefit more, and not just as an individual, but as a community or as a communal good.
So if I understand you well, then...
I think some of the things that the government has done.
If I understand you well, is it some sort of a social insurance fund?
Yes, we're actually moving from initially we had the National Hospital Insurance Fund. We moved away from that. Now we had the National Health Insurance Fund. The President very recently has now assented to several bills, including to the Social Health Insurance Fund. So you are correct that the currently direction is actually we are moving towards the Social Health Insurance Fund, and it is based now on a legal basis. It is based on infrastructural and systemic changes. It will be more of preventive, promotive, more than very curative, where they're just waiting for people to be sick. So it will also be taking into consideration that it can actually give or pay for services that are more preventive, like screening, counseling, and also promotive, things like nutrition, issues like health education, advocacy and behavior, social change communication.
Thank you so much, Doc, of which you've mentioned about something to do with preventive. But again, as we speak, we are a Sikh community, honestly speaking, because I'm working in one of the Muslim institutions and I am here every day. We receive cases of medical cases, talk of pressure, talk of cancer, talk of diabetes, to mention but a few. We are a Sikh nation. So in this UHC cover right now that I have, are there specific healthcare services that the current Muslim community, talk about the lifestyle diseases, are there covers that would help the Muslim community right now as we speak, over and above the prevention and the promotive and all that?
Yeah, I think more importantly, as you have talked, there's a lot of lifestyle diseases currently because of how we have changed our lifestyles, the types of foods that we are taking. We find that so many people, they sit for a long time, whether they work or when they're not work. People don't have much exercises. Our food styles actually has been now, we have moved away from our traditional foods that were more nutrient and were more important than what we're having now. More people now are eating fried food, what we call the snacks and fast food, which are not good. So what the system is doing currently, we have initiated, or now we are reloading what you're calling the level 1 community health services. Very recently also the president commissioned 100,000 community health promoters. Their main function will be to educate people on behavior change communication. Also, they'll be doing basic screening. As we are speaking, we have seen that when they have started going to their households, they have found there are so many clients or people who are in the households who actually have diabetes, hypertension, and they didn't know. So this will help in the earlier diagnosis and also management. But at the same time, they are going with the other health communication, informing them of several aspects for the continuum of life, for the children, what needs to be done for them, for example, the immunization, for the middle age, for the reproductive health population, and also the health, and more importantly, what are some of the things that the people at different times of the age you should be screened or should check. Many people do not know that it's important for children, for example, you could check when they are born. Their eyes, are they normal? Just seeing a bright light, it could mean actually a potential cancer, which is we call retinoblastoma. Just checking that who has been born on the back, the spinal cord, if it has some hair or it has a swell, it indicates spinal problem. Reproductive age for the women and also for the men, it's important for people to know how to check for breast cancers or to be checked. For the ladies, the cervical cancer. For the man, prostatic check. Even colon cancers, intestine. But how many of us really know that at different time of your lifestyle, there are several things that we should check?
Thank you so much, Doc, for that. But again, now still going back to the question, I mean, that is preventive, that is promotive. But again, right now we have as a community, and I'm asking this because in several other cases before, we've had incidents where there are limitations. For example, someone would come seeking for medical assistance, and of course, you would, the first question you'd ask, do you have, initially used to ask, do you have an NHIF cover? They'll say yes, but again, it can only cover up to a particular extent or a certain limit, right? So the question is then, does it help or will it help to cover such lifestyle diseases, particularly for the Muslim community that are suffering? Can we then, as an institution or any other institution that are engaging in several medical appeals every now and then, refer them, you know what, go ahead and take up the UHC cover, go ahead and take up the government cover, you know? Can we then do that and be comfortable that they're going to be sorted, Dr.
Yes, the current social health insurance, actually it will be uh, bringing out equity and services in terms that it will have no much difference for all the members, despite the fact that people will be paying or they need to pay according to their social economic status,
Yeah.
so that we bring in large numbers. Currently, had mentioned that we have only 20%, 22% of the people who are in the cover. So when we move this to about 80%, it means that we'll have many people who are joined the cover, and it will be a communal support. And this cover currently, it will have no much difference for all the people. It will cover almost 13 benefits packages for everybody. It will be the same, despite that you are paying according to your social economic status.
Thank you so much, Doc, for that. And we're going to come back to you after paying our bills. We need to go for a very short break. But again, when we come back, there's one thing that I really want to know. It's exactly that 5 minutes past 8 o'clock right now. We need to go for a break. But again, when we come back, there is one very extremely important thing that I want to know. Given the communal lifestyle that we have, right? And Doc says that we have to pay according to our social status. So someone who is in the brackets of millions, and again, supporting a number of people, let's say hundreds of them in the village, then how is the division going to be? Who pays what? Or does he give them the money for them to pay themselves? Or if he decides to pay himself, then how much is he going to pay and how is he going to pay? This and much more after the break.
Horizon TV, the beacon for the nation.
Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah wa thana'u lillah wa salatu wa salam ala rasulillah. Allah subhanahu wa ta'ala states in the Holy Quran, and He says, إِنَّمَا الْمُؤْمِنُونَ إِخْوَةٌ. The believers are nothing but brothers. And our brothers in Palestine are going through a lot, and we need to support them in any way possible. We Muslims here in Kenya, we can do two things to support our brothers. Number one is make dua for them. The same way that we are making dua during our salawat, Salat al-Fajr, Dhuhr, Asr, Maghrib, Isha, we do qunut in our salah, and our Rasul sallallahu alayhi wasallam used to do this, and this is known as qunut al-nawazil. And you can also remember them in your dua when you're praying at night, or when you're breaking a fast, or between adhan and iqamah. The second way that we can help our brothers is support them financially and send them humanitarian aid. If you're willing to support them, you can send your contributions via M-Pesa, pay bill number 150770, and account you can write Gaza, G-A-Z-A. We ask Allah subhanahu wa ta'ala to grant victory to our brothers in Palestine and Gaza, and we ask Allah subhanahu wa ta'ala to ease on their affairs. Wa akhiru da'wana alhamdulillahi rabbil alameen.
Verse of the day.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. وعباد الرحمن الذين يمشون على الأرض هونا وإذا خاطبهم الجاهلون قالوا سلاما والذين يبيتون لربهم سجدا وقياما والذين يقولون ربنا اصرف عنا عذاب جهنم إن عذابها كان غراما إنها ساءت مستقرا ومقاما.
Pearls of Wisdom.
Abu Huraira radiallahu anhu narrated that the Prophet sallallahu alaihi wasallam said, "Whatever I have commanded you, do it, and whatever I have forbidden you, refrain from it."
Horizon TV, the beacon for the nation.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Live Real Talk, and we are talking to Dr. Salim Ali, who is all the way joining us all the way from Naivasha. Dr. Ali, thank you so much for keeping it Live Real Talk and Horizon TV. Assalamu alaikum, Doc. Dr. Ali. Hello, Doc. Assalamu alaikum. Doc, can you hear me well?
Wa alaikum salam wa rahmatullahi wa barakatuh.
Naam, Dr. Jazakallah khair. Thank you so much for keeping it Horizon TV, and thanks so much for keeping it Live Real Talk.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Jazakallah khair. Now, Doc, we talk about the contribution to the fund as per the social status.
Naam, I can hear you properly.
And the question here is that how then do the Muslim community, given our communal nature, whereby you can find one person who is in the top of the pyramid, would be supporting, let's say, hundreds, if not thousands, who are in the bottom part of the pyramid. So in that case then, how does it work? As you said, the contributions will be as per the social status. So it's then, I'd assume, the person at the top of the pyramid will be contributing higher compared to the person at the bottom part of the pyramid. So if this person who is at the top of the pyramid supports financially, supports them education-wise, supports them in terms of their monthly or daily ration, in terms of what to eat and what to put inside their mouth, he is supporting and basically supporting their lifestyle. So then, how does it work in terms of their contribution into the fund? Daktari? Hello, Doc.
So there'll be several things that will be put into consideration so that people can contribute to this fund. There are facilities that will be assessed. There will be what will have benefit costs to the services that will be given.
Now.
And also there will be a percentage
We're going to take a very short break right here in the studio as you're trying to fix the delay and the challenge that you're having with Dr. Salim Ali Hussein, who is joining us all the way from Naivasha. We're going to take a short break as our technical team is working to fix the delay.
That percentage will be for the people who are salaried, so it will be capped at around 2.75. And then for the people who are not salaried, as I mentioned earlier, they will.
Once again, we're having a technical hitch again. I had announced that we're going for a very short break, and then the issue was fixed even before we did that. Now we're going to take another quick short break right here in the studio as we're trying to fix the technical hitch that we're having with Dr. Salim Ali Hussein, who has joined us all the way from Naivasha to talk to us about the universal healthcare. But in the meantime, I'm going to ask you to check it out, the universal health coverage that is an initiative by the government and the whole insurance packages that lies in within. As we are going to be back, I'll be taking in some of your questions as we are wrapping up the show to ask Dr. Salim. But now, until we fix the issue, it's going to take a few minutes, inshallah, a few seconds, and we're going to be back. You can check them up, and remember that we're streaming live on Facebook and YouTube as well. You can send in your questions. I've already received some of the questions all the way from Vihiga, Bungoma, Kakamega, Kwale, and I can see someone texting me from Dodoma, Tanzania. Thank you so much for keeping it Horizon TV and Live Real Talk. So we're going to take a short break, and we're going to be back in a moment. Jamani.
Horizon TV, the beacon for the nation. Verse of the day.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم.
وعباد الرحمن الذين يمشون على الأرض هونا وإذا خاطبهم الجاهلون قالوا سلاما والذين يبيتون لربهم سجدا وقياما والذين يقولون ربنا اصرف عنا عذاب جهنم إن عذابها كان غراما إنها ساءت مستقرا ومقاما.
Horizon TV, the beacon for the nation.
Assalamu alaikum warahmatullahi wabarakatuh, and thank you so much for keeping it live real talk. My name is Faisal Kassim. Apologies for what you had initially, that earlier on, that was technical hiccup that we're having with Dr. Salim. Doctor, you're back. Doctor, assalamu alaikum.
Walaikum salam, Faisal.
Thank you so much, and apologies for the technical hitch that we had earlier on. Now, the question that you had asked about the social status and the contribution into the fund, how exactly does it work, right? And for example, in this case, if the institutions, for example, Jamia Mosque Committee, Jamia Mosque Nairobi, that has health as one of key components in this institution, it supports a lot of medical bills, medical appeals. People come here, patients all the way, who have been taken all the way to India. They do come here for medical appeal and medical support. And walillah alhamd, Jamia Mosque then it's in a position to support them in terms of the few contribution that it has. So then in that regard, how will this work? Can Jamia Mosque, let's say, pick a number of people from whatever part of the pyramid that will be and decides to pay for them annually, or the person who's at the top of the pyramid, for example, and wants to support his kinsmen in the village? How does it work? How will it work then? Is there a framework that the UHC has provided for such initiatives?
Yes, the basic approach will be that the principal people are paying once the principal person pays in the household, it will cover also the household member. So it is an institution or somebody who is capable to pay for several people, whether monthly or annually. It will cover that with the family. So that will mean in case of any medical needs that will be covered. And as one of the things you mentioned, the issue of even going abroad to get services, these covers will have a benefit package beside the outpatient, inpatient. There is also foreign treatment if need be, if that services cannot be gotten here, beside other inclusion that initially in some of the insurance they are not covering, including eye care, dental care, mental health, and even taking care of drug abuse whenever it's needed.
Thank you so much, Dr. So basically, you can pay for the primary beneficiary, which will then translate and cover the whole family. That's what you're trying to say, just like the NHIF used to work.
Yes.
Thank you.
Yes, basically the same method.
Thanks so much. Juma from Kwale is asking, and I just want to read, are there any community engagement education initiatives under the UHC program that focuses specifically for the population of the Muslim needs? That is Juma from Kwale. He's asking, are there any community engagements or education initiatives under the UHC program that focuses specifically on the Muslim population and their needs?
So we, at the national level, we have standards and the guidelines that we give to the different health workers that we have, including the community level, where I mentioned we have the community health promoters.
No.
But we need to understand health services provision is a task of the county, not the national level. We give standards. So the PCN, for example, what we are calling the primary health care networks that we're establishing now, they have multidisciplinary teams. These teams are supposed to look at what are the needs, what are the priorities of the immediate population so that they take care of. So, for example, Juma in Kwale, if it's in a certain sub-county, so the medical fraternity in that sub-county or that primary health care needs actually should now come up services to their community, whether they're Muslim, for example, they are fishermen, they are flower farmers, so they should actually give services according to the need, because it cannot be a one-all fit, because we have different regions, we have different sections, and we have different people.
Thank you so much, Doc. You've said that this is primarily the issue of the county because it's a devolved function, but again, still, I'm getting a question from Halima, who is asking from Vihiga. And she is asking, are there any specific religious institutions or organizations that have been involved in the implementation or support of UHC cover for the Muslims in Kenya?
Yes, the UHC policy during development was an involvement of all stakeholders, which included the different faiths. We also, most of the time, we invite Interreligious Council of Kenya, which has most of the faith involved. Currently, what I mentioned, what you are calling the primary health care network, we have done a lot of sensitization, we have done a lot of stakeholder engagement, including the different faiths, which now they are supposed to roll it out to their members, which is in the counties, to the sub-counties, to the lowest level. And more importantly, currently, the government is actually putting them even into management. Some of these primary healthcare networks will have faith-based, will have the private, we will have even partners being involved in the management of this primary healthcare network so that it is all inclusive.
Well, thank you so much, Dr. I'm getting another question. The viewer did not disclose his name and say that what role does Muslim community play in shaping the development and implementation of the UHC cover policies? I'm sure that was part of the answer that you covered in the involvement of the IRCK, Inter-Religious Council of Kenya, or is there any an addition to that, Dr.
Yes.
Okay. And last question here.
That is just one other mention, but we usually try to invite several religious bodies, including, for example, the Supreme, it is inviting most of our planning sessions in a policy direction, but also including other things.
Okay. One last question from a viewer here. It's coming and say, kindly ask Dr. have there been any success stories or specific examples where the UHC has significantly improved healthcare outcomes for Muslims in Kenya? Interesting question there.
Yes, I will want to mention, I'm assuming that there is a higher percentage of Muslims in Kwale. The issue of what I mentioned, the primary healthcare networks that we are having, we have actually seen results when they're being implemented. They are getting people who are in the households, who are never used to be screened in the household. The promoters are screening them in the household, especially for hypertension and diabetes. And they actually now identified people who didn't know that they were suffering from this condition. And now they have been referred to get management, including medical management, but also supportive, preventive, and promotive services.
So there are success stories as you speak.
Yes, including Garissa. In fact, Garissa is one of our most success stories. We started our primary health care networks in Garissa, and we have seen several changes. We are seeing some of the health centers that did not used to do, for example, surgeries or cesarean section being done in those areas. Lamu, we also, for the first time, we are adding surgery that in 50 years in some of the facilities that have never been done. Now they're being done because these change or new way of doing things under UHC encourage people to change strategies to be taken to the people. And we are seeing that there are differences that which were not there previously. We are not there.
Thank you so much, Dr. Now, what would be your parting shot as you're wrapping up the show? What would be your advice now for the Muslim community? As you said initially in your first remark in the show that only 22% of the Kenyans in general, the uptake of the UHC is at 22% generally. And of course, you alluded or rather hinted that maybe the population of the Muslims within the 22%, or rather the remaining percentage is higher, let's say the 78%, the Muslim population would be slightly higher. So then what would be your advice for the Muslim community?
I think the first advice is that our health is our responsibility. We need to take care of our health and not wait actually even to be sick. So Islam, as you had mentioned, actually emphasizes people to be healthy, to pray for health, but also to work to be healthy. So issues to do with the exercises are things that are emphasized in Islam. Eating well, we know there are so many teachings, which is very important. We have seen that it does a lot of harm and health. We know now there are many studies saying that, for example, fasting is one of the main important ways of avoiding diseases, but also cleansing your body, because when you're fasting, your body actually sort of like does an overhaul. It is like rejuvenating itself. Taking things that are not harmful, Islam emphasizes that you do not harm yourself or others. So first, I would say that we need to treasure our health and work to retain it. Secondly, we need to prepare for when if you are not sick, and this is where I think the insurances issue come in. If we don't have an exactly Islamic one, what do we do? Is there an alternative that becomes a darura? So these are the ones that are there, and we have seen that they can help people. So, and we can get them by contributing a little. So if all of us can join hands so that it is a communal thing, we pay it, but we can be helped when need is there, and especially when the bills are high, it covers us. So I would encourage that for us, if we don't have another alternative, this could be a better alternative for you that can support you and your family members when the need arises.
Thanks so much, Thanks so much, Dr. Salim Ali Hussein, Jazakallah Khair, for joining us this evening and actually share the insight. Dr. Salim Hussein Ali is currently in Naivasha, and he is the Medical Services and Head of Primary Health Care at the Ministry of Health. He's made time for us this evening to tell us more about the UHC, Universal Health coverage. There is a plan under the current administration, and there is a whole plan for it, Vision 2020 to 2030, an important component of the society today. I cannot insist enough. I have seen, I have heard, I hear every single day. I am here, I experience it. Some cases you cannot even fathom, you cannot even wrap your head around it. These cases that, subhanAllah, they are mind-blowing, they are heartbreaking, that we receive here every single day. Today, it's them. We don't know about tomorrow. Is it going to be you? Is it going to be me? Who is it going to be? We ask Allah subhanahu wa ta'ala to keep us healthy each and every day. But again, at the same time, we need to take care of ourselves. My name is Faisal Kassim, and this has been the Live Real Talk. See you next week, same place, same time, as we'll be tackling yet another issue that is affecting you, the viewer, back at home. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
Horizon TV, the beacon for the nation. Pearls of Wisdom.
Abu Huraira radiallahu anhu narrated that the Prophet sallallahu alaihi wasallam said, "Whatever I have commanded you, do it, and whatever I have forbidden you, refrain from it."
Verse of the day.
أعوذ